Did you know that approximately 20% or 1 in 5 teens experience depression before they reach adulthood? Teen depression is this common for a few reasons, with one reason being because the teenage brain undergoes many changes and there are numerous life transitions during this time. Despite how common teen depression is, only about 30% of teens are being treated for it. This means that this issue often goes unnoticed by others. This is partly because depression looks different in teens than it does in adults. Furthermore, many of these signs are chalked up to just being a teenager rather than something more serious, making the signs of teen depression harder to spot. So today, on How to Charisma, we're going to look at 6 signs of teenage depression. Number 1, change in habits. One of the main signs of teenage depression is a change in habit. This includes things like eating or sleeping more or less than usual. For instance, a teenager might have been getting up at 9 a.m. every Saturday for years to go hang out with friends. Then you suddenly notice that they're sleeping in until noon and they're hanging around the room all day. If this goes on for a long period of time, this might be a sign that this teen is depressed. Changes in eating behavior can be another sign of teen depression. Maybe a teenager you know is suddenly skipping meals or, on the other hand, eating much more than they used to. They might have had a favorite food that they used to eat regularly and then suddenly not be interested in it. Or, on the flip side, they might eat much more of that food than they used to. Whatever the case may be, these are all red flags. However, it's important to be able to determine whether these changes in habits are due to depression or something else. For example, changes in eating or sleeping behavior might actually be due to a teen developing or maybe even starting a sport or something else of that nature. Some teens, for instance, will start eating and sleeping a lot more when they go through a growth spurt, or start a new sport because they have greater calorie and sleep needs. Number 2, short temper. While teens often have a reputation for being moody and irritable, this can be a signal more than just teenagers being teenagers. In fact, having a short temper can be a sign of depression in teens. This is especially true if this short temper seems to have come out of nowhere or doesn't seem to be provoked by anything. This is because depressed teens often suffer from enhanced feelings of irritability and anger, which leads to a quick temper. This may present in a variety of ways. The teen you know might become irrationally angry when they're asked to do their homework or if their parents ask them to do chores around the house. They might demonstrate more subtle behavior, like ignoring you or making a snide comment when you ask how they're doing. Other markers include defiant behavior. For instance, if the teen you know suddenly stops listening or ignores you, this is a red flag. Number 3, slipping grades. Another sign of teen depression is slipping grades. If a teenager was a straight A student and then all of a sudden are getting B's or even C's, they might be struggling with depression. This is especially true when they used to care about their grades and then suddenly appear to stop caring. This can be the case for several reasons. For one, depression can make people feel tired and more lethargic than usual. If the teen you know suddenly doesn't have as much energy as they used to, they likely won't have the stamina to study for as long as they used to, leading to slipping grades. Depression can also impair your ability to think clearly. So, even if the teen you know has the energy to study as much as they used to, this study time might be less effective because they're unable to think effectively and focus properly. As an example, they might have been able to ace a biology test by sitting down and reviewing their notes for only 2 hours the night before. Now, however, when they sit down for 2 hours, only an hour of this time is spent studying effectively. The other hour is used up trying to get their brain to focus, and they end up having to reread their notes multiple times to fully understand the information. Because of this, even if it looks like they're studying for the full 2 hours, only 1 hour of this may be constructive study time. Lastly, depression in teens can lead to feelings of not caring and a lack of motivation. This lack of motivation might mean that the teen you know simply stops caring about their grades, blows off their homework, and stops studying for tests. For example, before they may have pushed themselves to get all A's because they wanted to get into a certain college. However, now they don't feel motivated to even go to college at all due to their depression. so they don't see the point in studying hard to get good grades. Number 4, body aches. Body aches are one of the symptoms of teen depression that is not as often seen in adult depression. If you know a teen who is suddenly complaining of unexplained body aches or headaches, this may be a sign that they're depressed. A recent study in the journal Primary Care Companion to the Journal of Clinical Psychiatry explained that this is due to the fact that the same neurotransmitters, the messengers that carry information between nerve cells in your brain that affect mood, also affect pain. Serotonin and norepinephrine are two key neurotransmitters that affect mood. In fact, serotonin is known as the feel-good hormone. In someone with depression, their levels of serotonin and norepinephrine are often lower, and because these neurotransmitters also affect perception of pain, someone with depression who has lower levels of serotonin and norepinephrine might feel more body aches and headaches than usual. Note that we're talking about unexplained body aches. Similar to changes in habit, it's important to distinguish body aches due to depression from other potential reasons like growing pains or soreness from exercising, which are part of normal teen development and are not depression related. Number 5, addiction. While it's not abnormal for people to experiment with drugs and alcohol during their teens, addiction to drugs and alcohol can be a sign of teen depression. This is because they're using drugs and alcohol as a coping mechanism to deal with their feelings of depression. For instance, a teen you know might try to mask their sadness or feelings of hopelessness by getting drunk or smoking cannabis. If this temporarily makes them feel better, they might develop an addiction to drugs or alcohol as sort of a band-aid solution to their depression. In the long run, this doesn't solve the underlying issue and will likely only lead to more problems down the road. However, it's not just drug and alcohol addiction that can signal depression. Technology addiction can be another symptom and an additional way for someone to cover up their feelings of depression. If the teen you know is glued to their phone all day, spending hours scrolling through social media or playing video games nonstop, this might be because they're trying to use technology as an escape or distraction from their depression. As we've seen before, this is especially the case if this is a new habit they've formed. To make this clearer, let's say that the teen you know used to love going outside to play sports with their friends. While they'd bring their cell phone and would post regularly to social media, it didn't get in the way of their other activities. Now, though, you notice that technology has taken a priority for them. Even if they're outside with their friends, they might be sitting on the sidelines of the sports field scrolling through social media. At dinner, they always have their phone in front of them and make little conversation with their family. And after school, they go straight home and spend hours playing video games by themselves. These are all red flags that there may be something more going on. However, as we mentioned before, it's important to distinguish between addiction being due to depression or some other factor. For instance, if the teen you know was obsessed with video games as a kid and continues to play them a lot as a teen, this may be more of a habit at this point rather than a sign of depression. Number 6, staying in room a lot. While it's normal to think of a room as a sanctuary of kinds, if a teen is spending too much time in their room, it might be time to take a look at why. If they're using the room as a way to isolate themselves from others like friends or family, or to hide behaviors we've mentioned previously like drug or alcohol use, it might be time to consider that this may be due to depression. Staying in their room might also be a sign of underlying signs of depression like abnormal fatigue or a lack of motivation. Instead of engaging with the world, a depressed teen might prefer to spend time alone, and their room is often a place where they choose to do this. Let us know in the comments if we missed anything. While you're there, let us know what topics you'd like covered next. As always, thanks for watching How to Charisma. Don't forget to like and subscribe.